let me guide you through this portion of the procedure, mitral bioprosthesis PVL closure. First, let's look what kind of prosthesis he has. As mentioned earlier, he has a 29 millimeter Medtronic mosaic porcine bioprosthesis. And this is the image of such a prosthesis. And you see that there is a black dot at the top of the strut, and that's the only radio-opaque part of this prosthesis, which represents a significant challenge in fluoroscopic imaging of the prosthesis and therefore in fluoroscopic guidance of paravalvular leak. And therefore, transesophageal echocardiography will be exceptionally important in guiding paravalvular leak closure in patients like this. And let me just show you chest X-ray of this patient and what I mean that the lack of radiopacity of this prosthesis. So this is a chest X-ray of this patient, and I will blow two parts of this image. So this is his mitral bioprosthesis, and actually see there are only 3 radio-opaque markers on this bioprosthesis, which are at the tips of the struts and away from the sewing ring. And it is at the sewing ring that the paravalvular leak occurs, and it's at the sewing ring level that the paravalvular leak closure will be performed. So therefore, these markers do not provide us with the fluoroscopic location of the sewing ring. And the other part of the chest X-ray, just to remind us that this patient had already undergone successful Watchman device closure of the left atrial appendage. So now I'll give you a series of radiographic images of a different bioprosthesis and actually see that this particular prosthesis that the patient had, Medtronic mosaic, is the least radio-opaque of the series of bioprosthetic valves that are commonly implanted around the world. So now let's start with the mitral bioprosthesis PVL closure using 3D imaging. Again, we'll recognize that this is a bioprosthetic valve in the mitral position, visualized in a so-called surgical view. And you see that the transseptal procedure has already been done, and that there is a catheter across the interatrial septum, and then through the catheter is the wire, and the interventionalist is trying to pass its wire blindly through the paravalvular leak. Maybe we can help interventionalists and increase the success and ease of passing this wire through the paravalvular leak. How can we do that? So we can actually combine the 3D echocardiographic imaging with fluoroscopic imaging in what's referred to as fusion imaging. So now you can see again 3D transesophageal echocardiographic imaging of a bioprosthetic valve with a significant paravalvular leak at 5 o'clock. And in the bottom part of the image, you will see the TEE fluoroscopic image. Now that demonstrates that we are in a dual mode imaging of fusion imaging between 3D transesophageal echocardiography and fluoroscopic imaging. Using specialized software, we can then place a marker at the location of paravalvular leak on a 3D transesophageal echocardiographic portion. And here you can actually see that we have placed a marker directly at the paravalvular leak. And now this marker that it's placed on a 3D transesophageal echocardiographic imaging will be projected into the fluoroscopic space for guidance by the interventionalist. Now you can actually see mitral prosthesis together with the wire passed through the paravalvular leak exactly at the location where the marker was placed on a 3D transesophageal echocardiographic image. But now let's move to the fluoroscopic space, and essentially you see that this dot that we labeled as a 2 is actually projected in the fluoroscopic space, and it's exactly through that dot that the interventionalist passed the wire to go through the paravalvular leak. So therefore, this demonstrates the power of a combined fusion imaging, transesophageal echocardiographic imaging, where we placed and localized the PVL, and then that image is projected into the fluoroscopic space, allowing the interventionalist to successfully pass the wire through the paravalvular leak. In the next step, you see that the device, a closure device or a plug, is placed into the paravalvular leak to close it. And now I will show you a series of these devices. These are AVP devices or vascular plugs. They come in 4 varieties. In this case, we use the AVP2 Amplatzer plug, which has 2 short discs and a larger disc in between. So just to see what the appearance of these devices when you compare them on fluoroscopic and 3D TEE imaging. And now we will proceed with the deployment of this AVP2 plug inside the paravalvular leak. Now again, this is a 3D transesophageal echocardiographic image in the surgical view, and you see that now a plug is being opened. The left atrial disc is opened, closing the paravalvular leak. In the next image, we can release the device, and we will check also with the color Doppler and other imaging modality whether there's satisfactory position or not. Now you can see the nicely placed device. It's stable and closing the paravalvular leak roughly at 5 o'clock on this surgical view of the mitral prosthesis. And that's the highlight, the location of the AVP2 at the side of the mitral bioprosthesis. And now we can turn on color to check if we have closed this leak. And it appears that there is a residual flow between the left ventricle and the left atrium. Now we can ask ourselves, was this a successful closure or not? So it's important to recognize that after placing the device, there will be continued flow through the device, and will only after several weeks, when the device endothelialize, that will be complete closure. So this is essentially satisfactory and a successful closure of paravalvular leak, and the flow will stop in several weeks. And actually you can see this from a review article of these devices. Essentially the authors concluding, strictly speaking, that these devices are not plugs that can instantly close or seal the leak, and essentially takes some time, several weeks, to endothelialize and close this procedure. And now may I conclude this presentation with 2 major points. One, that 3D transesophageal echocardiography is essential in guiding a variety of percutaneous procedures. In this presentation, I showed you the utility of 3D TE guidance of a Watchman procedure for closure of the left atrial appendage, as well as a 3D TE guidance of paravalvular leak closure. And in case of paravalvular leak closure, we have augmented the power of 3D echocardiographic imaging with the fusion imaging between echocardiography and fluoroscopic imaging. I would like to thank you, and I hope you enjoyed this presentation. I would also like to thank my team and the numerous people who were involved in these procedures. I would like to thank Dr. Larry Chinitz, the leader of our electrophysiology program, where the Watchman device was implanted, as well as Dr. Matthew Williams, the leader of our structural heart disease program. I hope you enjoyed this educational presentation, and thank you very much.